Everyone, and welcome back to the Healthcare and Healing Podcast.
I'm Kira.
I'm Molly.
I'm Crystal.
I'm Isabel.
I'm Rose.
And I'm Dana. This is our sixth and final episode that will hopefully give you all a better idea on how these European countries are doing today. We really wanted to talk about the recovery phase of the pandemic and end on a more positive note, but seeing as it's only summer 2021, only a year and a half after the first cases were found throughout Europe, not all countries have really had the time needed to recover. So instead, we'll give an update on the current state of each country, starting with how they're doing infection rate-wise and if they're all still in lockdown. For Italy, at its peak, there were almost 800,000 active cases, and currently there are only around half that at 41,000. The country is reopening using a zoning system, which is more decentralized, to show where it is safe to travel and where restrictions are tighter. Molly, what about in the UK? How are they doing?
While the UK has been pushing for reopening since vaccinations began, it still remains under some restrictions, such as isolation requirements from certain countries and mask mandates. Unfortunately, due to the Delta variant, which I'll go into a little bit more in depth in later, case rates have been drastically rising in the past few months, despite being one of the most vaccinated countries in the world. So there's still a bit to go until we reach full reopening and recovery.
And
As in the case,
how about Spain? How are they doing?
as in the case of many other European countries, Spain is currently experiencing a rising number of COVID cases due to the rapidly spreading Delta variant. On July 13th, Spain recorded 43,960 cases, which is the highest case count since February 8th. While it may be too early to tell, Spain appears to be on the verge of a fourth wave after experiencing a third wave between January and March 2021. Certain autonomous communities have reinforced curfews recently with the hope of avoiding a fourth wave. Additionally, many Spaniards have been or are on their way to being vaccinated.
Oh my gosh, a third and fourth wave. Crystal, I know France's response was a little bit different from Spain. Have you seen them have different results because of this?
Yeah, so the France results are actually very similar to Spain, but in terms of new hospitalizations and daily death toll, they remain very low, but they are experiencing in France a rising number of cases due to the Delta variant as well, like Spain. And I think it's good to mention that there was also a recent third wave in Spain after the retraction of the restrictions from the second lockdown. And so there was a third lockdown instated in order to ensure French safety. And as the COVID-19 infection rate started to go down again, the French government started loosening the restrictions between May to June. And it is still unknown yet whether this was the right call on behalf of the government in terms of citizen safety.
And Kira, what about Germany?
So right now in Germany, we're at about 90,000 cumulative deaths since the beginning of the pandemic. As of July 13th, we counted 820 active cases. Looking towards the vaccination rate, it's a little bit troubling. It's hovering around 42%. So most of the older adults, are getting their vaccines, but the lower rates are primarily among younger Germans. So Germany still has some travel and quarantine restrictions in place for certain countries.
And Rose, I know Lithuania is a little bit different. Can you start off by talking about that?
Yeah, actually, I didn't realize how well they're doing, but listening to you all, Lithuania is doing pretty well. They have around 6,700 active cases, but their cases are declining daily. Lockdown is beginning to lift. They kind of had, well, not a third wave, but it was kind of a prolonged second wave that is ending right now. So lockdown is lifting, facial coverings are still required in some spaces, and workplaces and schools are recommended to close, but not required.
So if you don't mind me asking, what exactly is Lithuania's secret? Why are they recovering faster than other countries are?
No, I love that question. But there isn't a whole lot of research on this yet. I have, a firsthand source. Virginia, who is, the inspiration for me studying Lithuania, just went back to Lithuania for a visit to see her family. And I asked her, what's kind of going on. And she credits the new prime minister for them doing very well. Apparently, the prime minister is very on top of things and enforcing lockdown, but also I think their main secret is vaccinations. And I think there's a lot of pro-vaccination sentiment. Right now, around 41.8% of the population are fully vaccinated. But to even encourage more vaccinations, Lithuania has a vaccination information line that anyone can call, and even offers free transportation to a vaccination site, particularly for older people with restricted mobility. And I think therein lies their secret, and hopefully this positive trend continues.
Yeah, I mean, that vaccination rate sounds super awesome. I wish I could say the same for Italy, who actually, unfortunately, is at the opposite scale side of the spectrum. They've had to work in an uphill battle against anti-vaccine sentiment. Even though in April 2021, they were actually the first country to mandate the COVID vaccine for all healthcare workers. What about in the rest of your countries? Have you found vaccination rates high, low? Kira, what about you first?
Sure, I can jump in first. So I know I've kind of had these statistics. I don't want to repeat them too much, but around 40% of people in Germany are fully vaccinated. This vaccine rate is 90% for those over 60 years old. So Germany's encouraged vaccination, but ultimately hasn't decided to make the vaccine mandatory. And recently, Angela Merkel met with leaders in Germany's 16 states. They endorsed lowering the age limit for vaccination for COVID, so kind of around ages 12 to 15. However, they're still waiting to hear on decisions from the European Medicines Agency on lowering that age, which should help curb the spread of the virus as well.
Yeah, Spain also has about 40 something percent of its population fully vaccinated, and 55% of Spaniards had received at least one dose of the vaccine as recent as July 2021. Spain's prime minister announced in April that Spain's goal is to have 70% of its population fully vaccinated by late August 2021.
Yeah, and it's very similar for France as well. So about 53% of France's total population has received the first dose of the vaccine, and 41% of the population is fully vaccinated. But the number of doses administered each day has declined throughout this time period, as many remain reluctant to get vaccinated, and this includes healthcare workers being reluctant as well.
Yeah, so compared to other countries in Europe, the UK is in a somewhat unique position. This is mainly due to Brexit having occurred just a year and a half ago. By being outside the European Union, the UK has been able to gain vaccines and distribute them without potential sharing with countries who don't have the same financial resources to access them. Currently, with 66% and rising of the country being at least partially vaccinated, and significantly higher rates in the smaller regions of Scotland, Wales, and Northern Ireland reaching up to close to 90% gotten their first shot, it is significantly ahead of most European countries.
So on the opposite side of vaccination, I kind of want to turn all of our attention towards the Delta variant that has been becoming more and more common throughout the world as of summer 2020. Have any of your countries experienced this specifically? Maybe Molly in the UK, maybe you could start off.
Yeah, so since the Delta variant seems to have originated in the UK, it has been hitting the nation very hard. Currently, case rates are concerningly high, averaging about 50,000 per day, which is significantly higher for reference than the case rates of much larger countries, such as the United States, which is currently sitting at about 25,000 cases per day. Despite this, very few COVID restrictions are currently in place, and the country is planning on fully reopening this month.
Similar to the UK, France has also been experiencing a rising number of COVID cases due to the Delta variant. so much so that the president of France, his name is Emmanuel Macron, he announced this past Monday that they're going to begin imposing restrictions again, but this time it's only for people who are not vaccinated. So he announced that only people who are vaccinated or recently tested negative for COVID-19 will be allowed into bars, restaurants, malls, as well as transportation services. And this has caused very recent protests throughout France over the new health pass and over the strictness of the new health guidelines as well.
And I just wanted to echo in Germany as well. We're facing a similar issue with the Delta variant spreading quickly, with recent warnings say that 90% of cases in Europe will be because of the Delta variant in August. So German officials are trying to figure out now how to best combat the variant, which should come through vaccination.
Geez, so maybe recovery was, like we said, not the right title to use for this episode, but kind of to turn our conversation towards that way. I know in Italy, COVID-19 made it necessary for the Italian healthcare system to expand into telehealth. Before, because of the austerity measures, this side of healthcare was excluded from coverage and wasn't really even developed in Italy until after the pandemic began. Did anyone else have a similar experience with their country with changes to the healthcare system during or after the pandemic?
Yeah, Spain also, like Italy, has invested quite a bit in the development of telemedicine in the last 18 months. And I believe at least that this technology is likely to outlast the pandemic.
So then going along this line, I was just wondering, kind of to wrap this up as our last question, maybe you all could speak about what lasting impacts COVID will make on your healthcare systems in your countries. I know for Italy, this pandemic definitely will affect the healthcare system and the country as a whole. The funding for the healthcare sector was one of the things that was severely cut when austerity measures were put into effect. And it was a large reason why Italy was so vulnerable to COVID in the beginning. I think in the future, healthcare might be prioritized more, hopefully prioritized more. And the pandemic also brought the North-South divide of regions into the forefront of Italian politics. And while I don't really think they'll ever go into a fully centralized system, they might enact some policies to help regions that are falling behind in terms of standard of care or other things healthcare wise. Rose, what about in Lithuania?
Yeah, kind of along the same lines. One of Lithuania's major disadvantages in the pandemic was the lack of funds dedicated to healthcare. They were pretty unprepared. So I believe, or at least really hope, that the pandemic will encourage the Lithuanian government to dedicate more funds and resources to the healthcare system.
I gotta say, I'm a little less hopeful with the UK's healthcare system change. And this is because one major disadvantage with their medical system is a lack of sustainability. By functioning on a shortage of doctors and nurses, it remains in a precarious state most of the time, and especially throughout the last year and a half. Despite this, after more than a year of challenges for these workers and pouring significant amounts of money into the NHS, the system is still not prioritizing its workers, despite COVID-related inflation going above and beyond a normal year. The national pay raise for employees of the NHS was only 1%. This has led to strikes, which have not led to progress or changing this policy. While COVID disappointingly has not changed how this country values these frontline workers, I believe that it needs to before the next crisis hits.
Yeah, similar to the UK, for France, their healthcare workers were also on strikes. Their public healthcare workers, as I talked about in past episodes, due to the decrease in healthcare workers, not enough healthcare workers, as well as horrible salaries. So I think going forward, hopefully France will start to prioritize healthcare workers, including making sure hospitals are not understaffed and that healthcare workers receive better salaries for all that they do. And I also think that for France, their pandemic preparedness was severely hindered by their prevention policy that was affected by the H1N1 pandemic. I think going forward, France will or should increase the rigor of their prevention policy and in order to protect against epidemics and other unexpected healthcare crises as well.
Yeah, as I mentioned in previous episodes, I think Spain should move towards a centralized healthcare system going forward. I believe that the politics between the regions have interfered with the ability to deliver the best healthcare possible in Spain. In the future, Spain will also have to reassess its austerity measures because doctors and nurses have fled the country for work abroad and a higher salary, leaving the healthcare system and the staff in many hospitals pretty bare boned. So Spain is likely considering currently and in the future how to best recruit future and support current healthcare workers.
Yeah, and finally with Germany, I think this is going to reiterate a lot of the ideas that everyone else had, but the pandemic left an indelible mark on Germany's healthcare system. And the problem isn't seeming to be related to Germany's spend on healthcare, which we've identified as 11% of GDP, but instead on a mismanagement of the system in its entirety. And that comes from conflict between the healthcare system as well, the science of it, and then the political running of the system. So I anticipate that pandemic preparedness protocol will continue to be refined over the next few years in order to prepare for future outbreaks and hopefully anticipate more cooperation between the political figures and regional leaders within Germany to make a unified approach.
Great. Yeah, I just wanted to thank you guys all for sharing your analysis and all of the facts you worked so hard to find. And to conclude not only this episode, but our entire podcast, I wanted to say thank you to everyone who's been listening throughout these 7-ish episodes, and to the Nanovic Institute for the opportunity to work on this project. We had a really great time researching these countries and recording these episodes, and we hoped you learned a little something on the way. So I'm Dana.
I'm Kira.
I'm Molly.
I'm Rose.
And I'm Isabel.
And I'm Crystal.
And this has been the Healthcare and Healing Podcast.